We will get started, and there might be a few others joining us, but that's okay. So hello, everyone, and welcome to the first installment of the Child Safety Link Webinar Series for 2025. My name is Mallory Cornelius, and I am a Health Promotion Specialist with Child Safety Link, and I will be moderating our webinar today, Lessons from the Roadside, Car Seat Use and Misuse in Nova Scotia. We would like to begin by acknowledging that we are in Mi'kma'ki, the traditional and unceded territory of the Mi'kmaq people. We are all treaty people who benefit greatly from the shared resources of this land covered by the treaties of peace and friendship. So I'd also like to address a few housekeeping items before we begin the presentation. This presentation will be recorded and it will be available to view after this session. Likely in a couple of days, we'll get it up and running. We also ask that you mute your mics and keep your cameras turned off during the presentation. And lastly, if you do have questions during the presentation, please put them in the chat box. My colleague Sarah will be monitoring them, and there will also be a time for questions at the end of the presentation. You can turn your mic on at the end at that point. I know there's also a Q&A section, but maybe just stick to the chat for now unless that works better for you. So I'd like to provide a very brief summary of Child Safety Link. We are an injury prevention program at IWK Health dedicated to reducing the incidence and severity of unintentional injury to children and youth in the Maritimes and Atlantic when appropriate. Child Safety Link is committed to working with community organizations, governments, and other partners to ensure children are as safe as necessary at home, on the road, and at play. Our at-home work includes poisoning and falls prevention. Our on-the-road work includes child passenger safety, which you'll hear all kinds of things about today, and pedestrian safety. And our at-play work includes helmet safety, concussion prevention, and ATV safety. Now I'd like to introduce our presenter for today, Katherine Hutka. Katherine is responsible for coordinating child passenger safety initiatives in the Atlantic region. She's a child passenger safety technician and instructor trainer, as well as being trained in safe travel for all children. Katherine is also currently the president of the Child Passenger Safety Association of Canada. So I will turn my camera off and hand it over to you, Katherine.
Hey, thanks, Mallory. Excited to be here this morning talking to everybody about some preliminary results from our roadside study. And also happy Child Passenger Safety Week. It's a great way to kick this week off talking about some of these results and some of the takeaways and the tools that you guys can use kind of throughout your work. So yeah, let's get started. All right, so I'd like to begin by acknowledging those who have funded and supported this work. So first of all, of course, Child Safety Link. At IWK Health, this study also received funding support from the Child Passenger Safety Association of Canada, or CIPSAC as we pronounce it. This research was also funded in part by Dalhousie, and Dalhousie was the primary investigator. And finally, we are grateful to Cybex Canada, without whose generous support the study would not have been possible. Okay, next slide. So I always like to start these off by talking about why injury prevention matters. So there's lots of reasons that injury prevention matters, but I always like to bring out the cost of injury. So for those listening who, might be making decisions at a higher level, what does injury to children cost in Canada? And so it's estimated to be $83 million per year. And of course, these costs reflect those sort of direct costs like healthcare and trauma and things like that, but they also reflect those community-based and family-based costs as well. The cost of leaving a job to take care of a child who's been injured, or the cost to society for a child who can no longer be a part of that society, for children who are also fatally injured. So I always like to say, like, there's some pretty high level reasons why this matters. And then when we get into it, why does it matter how we buckle up children? So we know that motor vehicle collisions are a leading cause of fatal injury for children in Canada, and that between, sorry about that, my Slides are obscured when people join. And between 2011 and 2022, on average, 65 children between the ages of 0 and 14 were fatally injured each year due to a motor vehicle crash. So this is not an insignificant number. This is a primary cause of unintentional injury to children in Canada. Next slide. The good news is injuries to children in motor vehicles are largely preventable. We know that when the right car seat or booster seat is used in the right way, the risk that a child will be hurt or killed in a crash is reduced by up to 71%. We know that car seats and booster seats and seat belts, when properly used, save lives and also reduce serious injuries as well. So there is definitely something that we can do. So before this study, what did we know? So the last roadside study was concluded in 2012, published in 2015. Since that study, there's been no other Canadian roadside studies since, and there really wasn't anything that was as comprehensive before that time either. And since that time, there's also no comparable population-based US studies to this depth. And so when I say population-based, I mean that we're taking a snapshot of what we assume, and we can extrapolate what the rest of the population of a place, that this might be an accurate representation. So there has been kind of in-depth studies where voluntarily people are coming to get their car seats checked, but there's not been anything where we say, oh, hey, let's just talk to the random people who are driving by and find out how they're buckling their children today. And also to observe that in depth into the level of detail that we were able to capture in a study like this. The other thing we don't know is what may have changed in the last 13 years. It's there, a lot has changed. Regulations have changed in our country, the car seats have changed, and the population has changed, as well as what might have been the results of all of our collective efforts for providing education and support for people using car seats and booster seats and seatbelts correctly in the last 13 years. And next slide. So what did we know from the previous study? So these are stats that have been quoted everywhere. I presented physically in Toronto a few years ago, and these stats, again, that came from Nova Scotia, were quoted by two different Transport Canada people who were talking about, what we know about how children are transported in Canada. So like these stats are the stats for Canada, and they were captured here in Nova Scotia in 2012. So at that time we found that 73% of harnessed car seats, so a forward-facing or a rear-facing car seat with a harness, were used or installed incorrectly in a key way. At that time, we found that 30% of kids in booster seats did not meet the 40-pound weight minimum to safely use or legally use a booster seat, and that 52% of children that were observed at that time in a seat belt did not safely fit without a booster seat. I want to kind of go forward. So introducing the 2025 observational roadside study, which finished data collection in 2024. So I probably should have called that 2024. So just before we get into this, I did want to say that some of these numbers are preliminary, and so they may change over time. The study has not been published yet, and what we're talking about now are the preliminary results that have been released in a report to the funder, to Cybex Canada, and they are going to release this information for the first time on Wednesday in a media release. So at this time, I'd ask that you not screenshot or share any of these slides just yet, at least not until Wednesday. And yeah, so let's get into it. What do we know? So first of all, a little bit, I talked briefly about how we captured this information, but I just wanted to kind of expand on that a little bit. So what happened was people would be driving by. Police forces or RCMP would direct vehicles that were transporting children under the age of 14 to our roadside check, okay, to off the side of the road or in a safe parking lot. Then a research assistant from Dalhousie would obtain informed consent to participate in the study and conduct a survey where we were asking the driver some questions about where the driver learned their information about how to install a car seat and some basic demographic information on the driver as well. Then a child passenger safety technician. Sometimes someone from, a Dell researcher or IDUK staff or Family Resource Center staff or a volunteer would complete an inspection on how each child passenger was buckled in the vehicle and document it on a check form, on a checklist. Then the technician would educate the driver on the safe use and or replacement of the child restraint of the car seat. So we would let them know what they needed to change, what we were going to help them change today, and help them make those changes on the spot for the most part. And also, we were fortunate enough to have seats to replace seats when seats needed to be replaced as well. When there was maybe a seat wasn't present that should have been, or a seat might have been expired, broken, damaged in some way. And then finally, before we sent everyone on their way, they also did receive a $10 gift card for groceries or gas as a thank you for their time. So I didn't know where to put this slide, but teamwork really does make the dream work, and we could not have completed the study without the help of so many of you, and hopefully some of you are on the call today. We are so absolutely grateful for all of the help and support of all of the folks who've come out to help us, including our police and fire departments, of course, our child passenger safety technicians who were kind of throughout the different organizations, some of whom were there as volunteers, and of course, our community support partners from Family Resource Centers, and other centers as well, kind of throughout Nova Scotia. We had fantastic community partners without whom we wouldn't have been able to do any of this. So thank you. All right, so what exactly was the finale of this? What did we do? What are the numbers? So we actually we completed 41 separate check events in 33 communities across Nova Scotia. When you break it down by the total collection hours of all of the people present, this work represents 500 plus hours of child passenger safety technicians actively checking seats and documenting, 100 plus hours of support person, people who were asking those survey questions or other questions, or other ways that they were supporting us, and 300 plus police and fire support hours as well, who were there, we needed them to stop the traffic and to make sure that that was the only legal way to do that. So this represents a lot of work, and that doesn't even include all of the work to plan those events in advance, and then to transfer all of that information into the databases that we use for the analysis, the cleaning of the data, and all of those other parts. So yeah, it represents a lot of work. Here is a map of all of the locations, the collection sites across Nova Scotia, just to give you kind of an idea of all of the places that we did go. We had a good mix of areas considered urban or rural as well. Okay, so what did we collect? So from 682 participating vehicles, so that's the drivers, we were able to document and collect information on 1,005 child passengers. And this represented an 89% participation rate, which is important to note because, this gives us a better way to kind of validate our information. Like it wasn't just the people who wanted to stop that day and were, it was a high rate of people who did agree to participate in our study. And so we feel that we have, confidence that the results of this study more accurately represent the population as well. And finally, we did have a number of 93 replacement seats were provided in total. But we did also note that more than that were needed. We were limited by the space we needed to transport the replacement seats to those sites. All right. So I just wanted to show this graph just to show that, who did we stop? Like who did we see? And these are all of the different child ages. So I just wanted to show here that we had a really good range of children of all ages at our sites. And part of that was by design. So we did, there was quite a few of these checkpoints that we did over the summer when we knew child passengers were being transported at all hours of the day. Because most of our checkpoints were in the morning or in the afternoon, we needed to make sure those children were in cars on the road and not in school. We also did plan others for after school times or during school pickup times. And we tried to have as many events as we could, like, at least 2 events on any day when the children were out of school. So due to like a PD day or whatever, to make sure that we could capture children of across those ages. This is just another graph showing that we did have a good range of children in every stage of seat. Yeah, okay. All right, so what did we collect about each child? The information that we collect on each child included their age, what stage of car seat that they were currently riding in, height, sorry, the T bumped out on both of those slides, and of course, their height and weight. We categorize the information that we collected on each child and how they're being transported in four categories of use or misuse. So we had stage-based errors. So that means like, was the child in the correct seat for, did they meet the, at that time, Nova Scotia legal minimums? And what about the recommendations for safety? What stage were they in? And did they meet those recommendations or those requirements? Then seat issues. So those included like, was the seat damaged, expired, not present, missing parts, that sort of thing. Finally, we have use and buckling errors. So that's like attaching the child into the seat, either with the harness or the seatbelt. That was our use of the car seat errors. And then we also had a category of installation errors, attaching the car seat to the car, or how the booster seat was being used in the vehicle. All right, so overall misuse on arrival. So when a child arrived, we, would complete the checklist and determine whether or not that car seat had any misuse or no misuse. And so these are our numbers. So of the children that we saw in a rear-facing car seat, or I did want to mention that this also includes non-use. And so where a child might have been not buckled and a rear-facing seat was present, or they should have been in that rear-facing stage. So the unrestrained children are also included in this misuse stat. So 77% of children in the rear-facing stage showed misuse in some way in their car seat. 89% of children in a forward-facing stage had misuse. 77% of children in the booster seat stage had misuse, and 55% of children in the seatbelt stage had at least one, area of misuse documented. The stat that you're going to hear this week in the report that's been provided to Cybex, what they did was they wanted to collate rear facing, forward facing, and booster seat misuse up into one number. And so that number is 81% of children in a rear facing, forward facing, or booster seat stage had at least one error or had some misuse in the way they were being transported. So it's not insignificant. Okay, back to the categories. Now I'm going to break it down by the ways that these car seats were misused. What did we find? So, our first misuse was those stage-based errors. So, is that child in the right stage for their age, weight, height, and the seat requirements? And I wanted to point out that this is by the current legal Nova Scotia requirements. And so, only 1% of children who were in the rear-facing stage were in the wrong stage. And so, what that means is there was a few children who had outgrown their rear-facing seat and were being transported in a seat it was outgrown. But the more significant number is that 9% of children who are riding in a forward-facing seat or facing the front were too young or too small to have moved to that stage legally. And so that would have been in Nova Scotia that they would have been under 1 year old or under 22 pounds, or that they didn't meet the seat minimum for their particular seat to use it forward-facing yet. 8% of children using a booster seat, again, were too young or too small to have moved to that stage. And 26% of children using a seatbelt alone not only did not safely fit that seatbelt to use it, safely by the recommendations, but were not yet legal to use an adult seatbelt in Nova Scotia. So a quarter of the children that we saw in the seatbelt alone needed a booster seat legally in Nova Scotia at that time. But not insignificant. The most common reason, of course, for all of these errors was that children were too young or too small to have moved to that stage. Okay, now we're going to get into those seat issues. Okay, so remember, seat issues included whether the seat they were using was damaged or expired, or there was an essential part missing. So there was something that the manufacturer said, like, you shouldn't use this car seat without this part in this way, or that a seat was not Canadian, or that there was no seat present, right? So there was no physical seat for this child. And so for the children who were rear facing, we found 9% had an issue with their seat of some kind. For forward-facing seats, we found 20% had an issue with their seat, and 26% of children in the booster seat stage had an issue with their seat. The most common issues were that there's a missing part that was required by the manufacturer for using the seat in that stage, followed by an expired seat. And this was really for booster seats only. So I'd say that was the number one reason that there was a seat issue with the booster seat, is that it was expired. It was past its useful life. Now we're going to get into what were the top car seat errors when we're talking about buckling a child into a car seat. And so the number one error that we found with, and I did put rear and forward facing seats on the same slide because they were the same errors, just different numbers. And so we found that for children who were in a rear and forward facing car seat, the number one error was that the harness was not snug. So the harness needs to be snug enough so that you can't pinch any fabric or webbing at the shoulder, so that all the slack is removed, mostly so that we can reduce that child's movement in a collision. So we don't want them to move further than, we want them to stay right where they are. We don't want them to ramp up and kind of out where their head could strike the vehicle seat. We don't want them to, in a forward facing seat, to go forward in such a way that, they gain momentum and more movement, and then more parts of their body could strike the interior of the vehicle or be damaged just by that added motion and acceleration. So we do want that to see that harness to be snug. We also found that the next error was that the harness straps were not in the proper position. So for a rear child in a rear facing seat, they need to be at or below their shoulders so that they don't ramp up and out of that rear facing seat and strike their head. And for a forward facing child, they need to be at or above their shoulders. And that's so that, again, they don't move that much more forward. If the straps were at or below their shoulders, there'd be so much more distance that their body could travel in a collision. And so we did find that was the next most common error. Finally, the chest clip not being in the proper position. The chest clip needs to be at the armpit level, not up around their neck and not down around their belly. The job of the chest clip is to keep those shoulder straps properly positioned over the child's shoulders in the event of a collision. And then finally, that the harness straps were twisted. We didn't find this so much with children in a rear-facing car seat, but for a forward-facing car seat, we did find this, that their straps were twisted, and that, all of this misuse kind of contributes and adds to the other misuses that we would find. So when we talk about this, none of them are in a bubble. So the harness may not be snug in 44% of cases. In some of those, the harness straps might not be in the proper position. The chest clip might not be in the proper position. And as well, the harness straps might be twisted. So they kind of all contribute to the overall story of misuse. But the reason we don't want to see twisted straps is because, when you're holding something down with a flat surface, it spreads that area of contact out. So when a strap is twisted, it's more of a direct pressure point, which could cause greater injury. And again, when it's twisted, it's harder to get it snug, put it in the proper position, and put the chest clip where it needs to go. So we found that was more common in forward-facing seats, probably because there's more strap, there's more child, and they're probably also helping do it themselves. So yeah, something to look out for. The top car seat installation errors that we found. The number one was the seat was just not installed tightly to the vehicle. And so we found this in 28% of rear-facing seats and 45% of forward-facing seats, which is significant. Again, in a collision, we want to see everything tight. We want to see everything secure so that we can reduce how much motion is occurring, how much momentum that child gains, in that movement in a crash. And so yeah. And there was a variety of reasons for why it wasn't installed tightly to the vehicle. In some cases, it just hadn't been tightened. It hadn't been tightened enough. But in other cases, it may have been issues like the seatbelt not being locked, right? And the family not knowing how to lock the seatbelt in some way. So there's a few different reasons for that. In rear-facing seats, the next top installation error that we found was that the recline angle was incorrect. And so the seat needs to be installed at the recline angle recommended by the manufacturer. and that the level indicator, there's no like one set rule for how to do that. All car seats are different, but there's always a way to set that car seat at the correct recline. This can affect lots of things, can affect the child's safety in a collision, but it also can affect their ability to breathe, depending on how old the child is and what their neck control and head control is. So we found that in 26% of all rear-facing children. And finally, another not insignificant number, we found that 45% of children in a forward-facing car seat did not use the tether. Okay. In addition to this, some of them weren't snug, some of them weren't tight, some of them weren't attached to the correct tether anchor, but 45% we're not using the tether at all, which is significant. Again, when we're talking about reducing that motion in a forward-facing child, they're going to rotate out around that seatbelt. That seatbelt's holding it in a crash, but that tether is holding the top part of the car seat back from rotating out around, and it reduces how much further forward that child's head will extend in a crash, and it could mean the difference between a child receiving no head injury and receiving a serious head injury or a concussion. So important to note. When it came to booster seats, we found kind of an even number of installation and usage errors, but we did find that some of the installation errors led to the usage errors. So that's why we kind of put like a little arrow here. And so in 44% of cases in a booster seat, we found that the seatbelt was misrouted in some way. And so that was, perhaps the lap belt needed to be routed underneath the armrests, or the shoulder belt needed to be routed through a belt guide that it was not routed through. So we found that the seatbelt was misrouted in 44% of cases in children in a booster seat. We also found that 23% had a twisted seatbelt in some way, which again could increase injuries, but it also makes it more difficult to place it correctly on a child's body. And then, of course, we found that 40% had the shoulder belt misrouted, and we felt that that would have led to, in some cases, a poor shoulder belt fit. So sometimes the shoulder belt was misrouted, but we still found that the seat belt, which is key with a booster seat, is where the seat belt fits on a child's body. Um, in some cases, they still had really good belt fit, and so we weren't, overly concerned about the safety in a crash. But in other cases, we felt that the misrouting of that shoulder belt led to the poor shoulder belt fit. And so that was a key usage error there. And then 30% had the lap belt misrouted. So again, if there was a little armrest or something, or a belt path, maybe it was up and over, maybe it was out and around, maybe it didn't, make contact. And we did see 19% had a poor lap belt fit, where in a collision we were concerned about where that lap belt was going to be placed on a child's body. Because again, a booster seat, what it does is properly position the lap and shoulder belt to fit a child's smaller body to make a squishy belly and not down off of their shoulder or not up over their neck, and definitely not under their arm or behind their back. Okay. Finally, for the children that we observed in a seatbelt, we found that 37% did not pass the 5-step test for seatbelt fit. So what we're looking for in a child who's no longer in a booster seat is we want to see them pass this 5-step test without a booster seat. So that is, their back has to be flat against the vehicle seat back with no gaps. Their knees have to bend comfortably over the edge. The lap belt needs to stay low and snug across their hips. The shoulder belt needs to touch their chest and stay between their neck and shoulder. And finally, that the child can sit like that for the whole ride, which was not something we could test. But for the most part, we found that 37% of the children that we saw between the ages of 0 and 14 in a seatbelt alone did not safely fit that seatbelt. In addition to that, we found that 26% of those children also did not meet the legal requirements for seatbelt use for Nova Scotia, which in this case would have been age 9 or 57 inches, 145 centimeters, or 4 feet 9 inches tall. And so the height matters because it helps them to fit the seatbelt correctly. But almost all of those children who did not meet the legal requirements for seatbelt use were under age 9. Almost all. There was only a few who were older than age 9. I think two that were older than age 9. Um, and like I said, they wouldn't have been included in this anyway because they would have met the legal requirements for those children who were taller and older age 9. So 26%, they were all under age 9. And so the solution for that, of course, is to keep a child in a booster seat for longer. All right, so I just wanted to directly compare the numbers that we had in the prior study, the numbers we've been quoting and reporting on all this time, that 73%, the 30%, and the 52%. And then there's a final number I haven't really talked about too much. We usually quote it as like less than 1% were found to be unrestrained in that 2012 study. So here it's reported as 99.6% were restrained in some way. And so the results of our latest study, if you want to go to the next slide. So what did we find this time? So for car seats that were used or installed incorrectly, a harness car seat, forward-facing or rear-facing car seat, we now find that there's 84% of those car seats are used or installed incorrectly in a key way. So that's not insignificant. Um, there's some good news when we look over at the booster seats. At that time in 2012, we found that 30% of children riding in a booster seat did not yet meet that legal minimum weight of 40 pounds. And this time we only found 6% of children were not yet 40 pounds who were riding in a booster seat. So well done us. The message is getting out there. Children are transitioning to a booster seat later than they were before. And finally, seatbelts. We found that 52% of kids in a seatbelt did not fit safely without a booster seat. And this time we found 37% of the children that we saw that did not have a booster seat fit the seatbelt correctly. The only thing I want to say about that number is I don't have complete numbers on what the age range was for the prior study. I know they saw children up to age 14, but I don't know what the distribution was. So we may have seen more 12-year-olds, 13-year-olds, 12 and 13-year-olds than in the prior study. So it's hard to compare apples to apples there because this 37% doesn't, it may take into account more older children. So, and then finally, a number that has, gotten worse for us was that we did find 97% of children who were restrained in some way. And so the number jumped from less than 1% to, I think it's 2.3. It's 2 point something anyway, that it must be 2.6 if it rounded out to 97. But a significant portion of children were unrestrained that we had found. And for that number, we included children who seemed restrained by the time we saw them, but then the children themselves confessed to not being restrained when they were pulled over on the roadside. They were like, "I wasn't buckled at all, just so you know." And I was like, okay, thank you. Noted. So we did find, I believe, 28 children who were not restrained in any way throughout the course of the study. So a little surprising. So when we talk about like what is improved, why might that have been? These are speculation. This is just like based on, our knowledge, what we believe might have been some of the contributing factors. So that later transition to a booster seat. So maybe there's something to do with the manufacturers, right? We now know that car seats, like the harnessed physical car seats with a rear and forward facing car seats, they have higher weight limits than they did in 2012. The regulations around that have changed, but they didn't change that much. We just know that consumers have asked for it, manufacturers have made those changes, and so there's a greater availability of car seats with a harness with a higher weight limit on them now, and so that might have contributed to the later transition to a booster seat. Again, the standards, the Canadian regulations for child restraints were updated in 2012, and so maybe that was a contributing factor as well, just with how the manufacturers responded to that. And also maybe education. We'd like to think that 13 years of advocacy, training, education, and support may have influenced a more correct booster seat transition. So what's gotten worse and why? Unrestrained children and overall misuse. And so maybe this might be something to do with increased barriers to using car seats and booster seats correctly. There may be language barriers that limit access to educational resources and may affect proper use. We also, and this is just a possibility, this is just something we're thinking, it we do have an increased variety of the way that car seats and booster seats work and vehicles as well. And so car seats have changed. I wouldn't say necessarily that they've gotten more complex. There were complex car seats in 2012, but I believe that that complexity has varied in different innovative ways that may also contribute to, it's difficult for us to say all car seats do this, all car seats work in this way because there is such a variety. And That's great. We have a lot of innovation, but it's possible that it may have contributed to misuse as well, where a family might have learned how to use one kind of car seat correctly, and now we've got this innovative, different, and new car seat, and well, I'm not really sure how to use that one. We also believe that the form is more detailed. We did base our child restraint collection form on, we built it based on the prior study as well, but we did expand it. And so it was more detailed. And so a more detailed child restraint form may account for increased documented misuse because we had more checkboxes. We were looking at more things. And just we were documenting more than the original study. And so that may have also contributed to the increased documented misuse. All right. So I just wanted to bring you guys to some tips. I know all of that was a lot of information. If you had five, I guess there's six takeaways today that you can pass on to parents and caregivers or to use in your own life, here are the tips. Number one, don't rush the stages. Keep your child in each stage for longer. They are safer in each stage for as long as they still fit that stage, that seat that you have in front of you. Two, make sure that your seat is safe to use, right? We do have helpful checklists at childsafetylink.ca for determining if your seat is safe, you know, has what is certified for use in Canada, not expired, has all of its parts, not damaged in any way. Three, make it snug. We need both the harness and the installation to be snug and tight, and that's on every ride. Or always use the top tether forward facing. It has been proven to limit injury. Use the top tether. It's there for a reason. Five, always follow the instructions for your seat. I know that there are barriers to following the instructions, but this is an important step. And when we guide families towards using their seat correctly, we're going to guide them towards using their car seat with their instructions. Manufacturers are responding to the call. They have more customer service options and more videos that are being released directly from the manufacturer to help families and caregivers do this. And finally, seek additional help and support when needed. Family resource centers, in some cases public health, manufacturers, retailers, and all of those places have child passenger safety technicians who can support families there. I also should mention that Child Safety Link does have a 1-800 number, a toll-free number for Nova Scotia, New Brunswick, PEI, and Newfoundland, where parents, caregivers, and those people who support them can call, and those calls are answered 8 to 4, and calls are returned the next day. So we do have a helpline as well, where someone like myself, but almost always Ashley, is answering those calls, and she's very knowledgeable and able to help and even direct to more in-person resources where available. All right, so what does this mean? Um, Anyone who transports children has a role in keeping kids safe in the car. So that's parents and grandparents and daycare providers and social workers and anyone who is helping parents, grandparents, daycare providers, and social workers as well. We know that caregivers need support that is accessible, that's non-judgmental, and that meets them where they're at. And in some cases, hands-on. So we also know that more outreach is needed in communities with identified barriers to correct use. I wanted to show this photo just to give you an idea. This was not common. This was not the most common kind of scenario that we were finding. But this, in some cases, was the scenario we were finding. So this mom was using the car seat that she had been provided when this child was born 2.5 years earlier from the IDBK. And you can see here she's using a rear-facing only car seat in a forward-facing direction with a lap-only seatbelt as though it was a booster seat. And so this family needs a little bit more help and support than just a toll-free number, right? This family needs hands-on intervention. She doesn't know what she doesn't know, right? She's buckling this kid up in the car seat that she was provided in the best way that she knows how. And she was so grateful for our help and really happy to find out, oh, okay, I'm doing it wrong. All right, that makes sense. Let's work on this. And so I originally included this photo to show some of our challenges in categorization. So like, is this child misusing a rear-facing car seat, a forward-facing car seat, a booster seat, a seatbelt? So how does this go into categorized misuse? But all in all, it really doesn't matter. This family needs a lot more help and support, and we were just so fortunate that we were able to provide that help and support and a new car seat for this family. And so we have some plans ourselves for some of the outreach that we're going to be doing in the next year and the years to follow. But it's going to take more than just Child Safety Link here in Halifax. We're going to need people in every area and every corner of Atlantic Canada offering real in-person support to these families. So I included the slide. I'm not going to go into everything, but I do have some implications for policy and practice, some ways to reduce misuse through collaborative evidence-based actions around education, enforcement, engineering, equity, and I also included some evaluation, where more studies are needed. I'm not going to read it all here, but I wanted to include it so that it was in the slides for any of you policy and practice folks out there who are like, what can I do at this higher level? How can I advocate for updated laws to align with best practices and all of the supports around them that are so needed to help parents and caregivers and everyone transport children safely? Okay, so I also wanted to include these best practice recommendations for revisions to provincial legislation. I've talked about them before. These were originally developed in a collaboration with Child Safety Link, the Child Passenger Safety Association of Canada, and Parachute Canada that were sent to transportation and health ministers in every jurisdiction in 2023. But I just wanted to talk about them briefly just to see how the numbers line up, because this was one of the questions that we were asked when we went out there yeah, I mean, how many children are being transported according to the recommendations in each stage? And so that first recommendation is to require all children to be safely buckled in taxis and rideshare vehicles. We didn't have a box for it, but there were some families that we observed that were in rideshare vehicles because we were stopping drivers. And so in some cases, there was a family in the back seat who was being transported in a rideshare. So I wasn't able to pull those out, but those were some of the folks that we did see. But it's important that if we're talking about all children, then those children in rideshare and taxi vehicles, they have deserve to be properly restrained as well. And there can't be a legal loophole that makes families feel safe and normalized to sit in the back seat of a vehicle with a child on their lap. Okay, taxis follow the laws of physics, same as any other vehicle. Second recommendation is to require a child to remain in a car seat rear facing until at least age 2. There's lots of evidence for this. And many of the car seats that we saw were had a minimum of 2 already. So there's I'd say probably a third of the car seats we saw had a forward-facing minimum requirement of age 2. The next recommendation is to require a car seat with a 5-point harness until a child is at least 40 pounds. We already have that. And adding an age minimum of 5 years old. I know 5 years old seems kind of high, kind of extreme, but we do have evidence that children don't have the impulse control to properly sit in a booster seat with a 5-point, or sorry, like a 3-point seatbelt until they're closer to age 5, until they're age 5. We have evidence that 4-year-olds can't do this and that 5-year-olds can. And of all of the children that we observed, none of the children under age 5 had exceeded 65 pounds. And so they all would have had an option to remain in a harnessed car seat. Um, and then finally, require a booster seat until at least 4 feet 9 inches tall, which we have. But then we have the really low age minimum of 9 years old. And we did not, I think we found one child who was older than 9 or younger than 9 who was 145 centimeters, who had that height. So the reason for the 12-year-old age limit, the reason for the age limits on all of these is because it's more easily enforceable, right? Police officers at the side of the road are saying to a family, how much does that child weigh? And the family is saying 40 pounds. They know what the minimum is, and it's difficult to prove that. It's difficult to weigh that child. And from a public safety messaging point of view, age minimums really do send that message. And so we're not asking that all children remain in a booster seat until age 12. We're basically essentially making the height the actual minimum, and the height is the most important thing for accurately fitting that adult seatbelt. And so that's why, children under the age of 12, makes sense, because we know that only 5% of children who are who are age 9 are 4'9", and only 5% of children aren't 4'9" at age 12. And so age 12 makes a lot more sense. Okay, if you want to go to the next slide. So I didn't put the other slide in to compare with how children met that legal minimum, but we did see, I think it was about 9% of children who were in a forward-facing seat legally needed to be in a rear-facing seat. And in this case, with the recommendations, that jumps to 14% of children who were not yet age 2. 20% of children in a booster seat were not yet age 5. And I wanted to mention too, even if the age was 4, there was only a few children who were younger than 4 in a booster seat. But it's one of those things that um, when we look at children who are fatally injured or seriously injured, who are less than age 4, we look at it and we say this was misused. If they were younger than age 4, they likely didn't have the maturity to sit in a booster seat, and we eliminate that data from moving forward, right? I've been involved in meta-analysis of data of children who have been injured or fatally injured who are riding in booster seats. And when it comes to children who were younger than age 4, we didn't count that data. So it would be important to state that those children, at least age 4, but better if it was age 5, because we just know they don't have the capacity to sit correctly. And finally, 37%, which is the number we quoted before, did not safely fit, were under 4 feet 9 inches tall, and riding in a seatbelt. Okay, so the conclusion is that children could be safer with age-based recommendations. Next slide. I wanted to provide everyone with some resources that they could use now. We're going to put these up on the community of practice, which I know Mallory is going to show the QR code and show you how to get there and how to join. But I wanted to talk about them briefly here. So the first resource is the Right Seat resource. We have this poster. They were mailed out to all of the family resource centers and newcomer organizations across Atlantic Canada in the last few weeks. If you didn't get one, you can drop us an email and we'll put one together for you. And we do have basic child passenger safety resources available in 14 languages, including videos. We do have resources for well baby visits too, so resources by age and stage that you can, if you work in a family practice or somewhere health related where you're bringing in children at different ages. These are the recommendations at each well baby visit. And this was developed with Nova Scotia Health, but I'm sure it would be applicable in other provinces as well. And then finally, if you yourself feel like you need a little bit of a refresher, if you want to be able to talk to parents and caregivers, we do have access, free access in Atlantic Canada to an online, it's a driver's program. It's called Child Passenger Safety Basics for Drivers. It was originally developed for those who transport children in a daycare setting or for social work or children in care who transport children as a part of their job. And so we do have access to, if you would like free codes for you or yourself or your organization, we can put the link for that up in the community of practice after this call. And that's something that we're very fortunate to have access to in Atlantic Canada. In all other places in Canada, it's $75 per registrant. And it was just through a partnership with Child Safety Link to provide the photos. It is myself in this particular photo that we provided for that program that allows us to have access to that for free in Atlantic Canada. So yeah, it's important to take advantage of that. So here's some resources that you can use today. And that is the end of my presentation. Mallory? I know we wanted to save a little bit of time to open it up for questions.
Yeah, thank you so much, Catherine. That was incredible. Great work. I know a lot of people have been waiting for these numbers. Really exciting week for everybody in the child passenger safety world and those who are maybe just learning and exploring. We are going to take some questions. Before that, I just wanted to remind you all that there will be a recording up on this presentation on our website and community of practice. Like Catherine said, we likely won't post it just for a couple of days just to make sure all of the other media sources are able to report on this as well. And if you're not already a member of the link in Atlantic Children's Injury Prevention specific community of practice, you can scan the QR code here to register. So I'll leave that up while we do some questions. And Sarah's going to monitor the questions for us.
Thank you. Yeah, and if anyone has any questions that they want to come off mute, that's more than fine as well. But so far, we've just had a few comments about having the resources. And you can access the resource through our community of practice, where the link is up right now on the slide. We did just have a question come in, Catherine. Were car seat accessories not included with the car seats that were looked at?
No, they were included. So we did document where like unregulated accessories were added to car seats and booster seats. Yeah, we did note them. It just didn't turn out to be like in the top three that we presented on today. Any other questions?
Not in the chat so far, but if anyone has any that they want to come off mute, that's no problem as well.
Okay, if there's no other questions in this moment, if things come up later, I'm sure Catherine would be more than happy to chat with you. Maybe not this week, but perhaps next.
Just before we go, Mallory, I do see that Tanner is on this call too, and I just wanted to give a shout out to Tanner and a huge thank you for this is his master's project. And it's going to be Tanner who, develops all of the papers that will be published and everything else. So I wasn't sure if anyone had any specific questions about the data collection or analysis or methodology that only Tanner could answer, but he is on this call. And so I just wanted to give a shout out and a huge thank you. Yeah, we would definitely not be where we are today without Tanner. And of course, the support of Mark Asbridge as well, who is the primary investigator on this particular study, and has overseen all of this work and supported us all along the way. So this is his work, and we're just fortunate enough to get to be the people who ask the questions and figure out what questions should be asked. So yeah, very grateful to Tanner and Mark Asbridge and Grace and Alexa as well, who have, been really, and Lauren, supporters from Dalhousie as well.
Catherine, we do
So many
have
people.
a question in the chat
Oh,
and then just
good.
someone with their hand up as well. The one from the chat came in first. I'm just going to read that. So it says, you mentioned car shares. Is there an expectation from parents when using public transit?
Right. So when it comes to taxis and rideshare vehicles, so a car that is driven by someone, the recommendation is that car seats and booster seats and seatbelts should still be used according to their recommendations. These vehicles, we have evidence that they have just as much a chance of injury as you would transporting a child in a passenger vehicle driven by a parent, a caregiver, a grandparent, or anyone. And so it's important to always use a car seat or booster seat on every ride. When it comes to public transit, for example, large metro transit buses, school buses, ferry boats, trains, car seats are not required or expected, and nor is the risk of injury the same. They are not passenger vehicles. But taxis and ride shares are very different from buses, ferries, trains. So just to kind of like break out public transit into those kind of two categories. So the expectation is that parents and caregivers should be using car seats and taxis and rideshare vehicles. But there is an exception where the taxi driver or the driver of the rideshare vehicle, the vehicle for hire, would not have a ticket that is issued to them to be responsible for how a child is transported. The law still states that a child should be in a car seat, a booster seat, or a seatbelt appropriate to their age, weight, and height. But there is this exemption for the driver of a rideshare vehicle or a taxi, and so it's unenforceable.
Thanks, Catherine. I have another question here. Was there a
In Nova
heads up?
Scotia, I should say that's in Nova Scotia. Newfoundland does not have such an exemption and is a star player. So if there's anyone from Newfoundland on, give yourself a pat on the back. Woohoo, Newfoundland. Required in taxis. So it can be
Awesome.
done.
Thanks, Catherine. Was there a heads up to the public that this observational study would be happening, or was this done without notice?
This was done without notice for the most part. There was sometimes that fire stations got ahead of themselves and got really excited and put something up on Facebook. I will say that the communities, especially small communities, were aware very quickly, sometimes within moments, that a roadside stop had been put up, and people in the community were sharing that information. And so sometimes people were aware of it, but we did try to end the event once the first families came and said, "Oh, I heard this was happening, and that's why I came." We were like, "Okay, well now we're kind of getting a biased result where people are coming to try and get this help from us who are here. But that let us know that people knew that the event was happening. And so that's another reason that we limited our events to 2 hours whenever possible. 2.5. That's kind of the max that we stayed at any one location on any one day, just to kind of reduce the risk of people knowing about it and either avoiding or coming on purpose to get their car seats checked.
Great, thanks, Catherine. And Tanner also answered that in the chat as well, so I can just give a little update for anyone who can't see the chat, but just, yeah, that this was done without notice, and this was just done to accurately capture how people are transporting children, and if they did receive notice, they would expect that the people might adjust the level of caution they have around child restraint use, which could compromise the ability to extrapolate these results to the larger population.
And we do expect that there were some families who, seeing a roadside event up ahead would say like, quick, get in the back seat, quick, buckle up. And the children told us as much. I was in the front seat before. I wasn't buckled up this time, but I did when my mom told me because they saw the police car. So whenever we heard that, we did document. Child reported that they were unrestrained, but I'm sure that there was more that we didn't see because people did have enough of a moment to kind of be aware and buckle up or change the situation.
Great. That is the last question that we have in the chat, but I do again see that folks are really interested in the resources. So I just want to remind that to join the community of practice, because you'll be able to access all of those resources on there where Mallory will be sharing them.
It's all on you, Mallory.
Yes, thank you so much. Perfect. Thanks everyone for attending today. Finally, I'd just like to promote our next two webinars of the 2025 series. So we have social determinants of injury attributable emergency department visits in Canada, and that will be on October 23rd with Dr. Claire Benny. And then we also have Understanding and Promoting Caregivers Home Safety Practices on November 19th, and that will be with Dr. Barbara Morangello. Those are also up on the Community of Practice, so if you're not on there, that's where you'll kind of get all this information first, but I do know we send it out as well to folks, and anyone is able to attend those. And that's us. Thanks so much for attending. Please feel free to reach out with any questions you may have, and have a great rest of your day.